Hi, Dr. Sinha. I just saw this patient. I'm just going to go review it with you real quick, okay? So her chief complaint, we have Miss Wells, a 28-year-old African-American female who presents at the clinic with shortness of breath, wheezing, following a near asthma attack that she had about 2 days ago. History of her present illness is she was recently at her cousin's house and she was exposed to cats, which triggered her asthma symptoms. At this time, the asthma attack onset, she notes that she had wheezing that was 6 out of 10 in severity, and her shortness of breath was 8 out of 10 in severity, in which that lasted about 5 minutes. At that time, she used her albuterol inhaler, and her symptoms decreased, although they did not completely resolve. Since the incident, she notes that she's been having about 10 episodes of wheezing and some shortness of breath approximately every 4 hours. Her last episode of shortness of breath was this morning before coming to the clinic. She noted that some of her current symptoms seem to be worsening, especially when lying flat, and their movement and be accompanied by non-productive cough. She awakens at nighttime with shortness of breath about 2 times per night. Her last episode of shortness of breath again was this morning prior to coming to the clinic. So only past medical history, she had asthma when she was diagnosed at 2.5 years old. Social history-wise, she did smoke marijuana for about 4 to 6 years, and her last use when she was 21 years old. She does not exercise. She does not currently use any tobacco, alcohol, or any illicit drugs. Health maintenance-wise, she was hospitalized about 5 times for her asthma. Last time when she was 16 years old. She's never been intubated from her asthma though. She does not currently have a pulmonologist or allergist, and she does not recently use her sphygmometer. She does not use the peak flow, and she does not record any of her attacks. She does not have a nebulizer at home or vaporizer. She is complaining that her current symptoms are starting to begin to interfere with her daily activities, and she is concerned that her albuterol does not seem to be as effective as it previously was. Just review of her overall system. Just currently her breathing is normal. Adductively, she has no any acute signs of distress. She is alert and oriented, and she sits up straight on the exam table. She remains eye contact throughout her whole interview and examination. Chest expansion is symmetric with respirations, normal phrenosis, symmetric bilaterally. Her chest resonates to percussion. There's no dullness. Bilateral expiratory wheezes in posterior lobes. Bilateral muffled words with notable expiratory wheezes in posterior lower lobes. There's no crackles noted though, but in the office sphygmometer, her FVC is 3.91 liters, her FEV1 and her FVC ratio is 80.56%, and her SpO2 is 97% on room air. So my assessment, so I'm going to be diagnosing Ms. Wells with unspecified acute asthma exacerbation, so J45901, related to her shortness of breath multiple times and her non-productive cough. Some differential diagnoses that we can use for Ms. Wells would be acute bronchitis due to respiratory viral, that's J20.5, or we can even do acute bronchospasms, J98.01. For my plan for her, we want to start Mrs. Wells on an inhaled corticosteroid, formoterol, such as glucosinamide, as a low maintenance dose. We want to encourage that she uses her albuterol still, meaning that her symptoms are happening more than 2 times a month, but it's less than 4 to 5 times a day, as per the GINO report. And then we also want to recommend her to start keeping track of her her asthma attacks and keeping a record in her book, and to utilize her sphygmometer, and also to follow up with an allergist to see if there's any triggers besides cats that's causing her asthma to act up, and she can follow up with us in about 4 weeks. What do you think of that plan?
I think this is good.
Thanks, Dr. Sinha. I appreciate it.